Luke from Vital Movements. A real solution for dental professionals, not only treating the symptoms. Exercise number 2 of the top 3 is open the books. Open the books is an exercise to help increase range of movement or recreate range of movement of spinal rotation. Okay, the spine should rotate, all vertebrae in the spine rotate a certain amount, and together they create full rotation of the spine. Majority or a big portion happen in the thoracic between T5 and 8. Then also a large percentage also in the cervical, with less so in the lumbar. Now, what I tend to see in practice is a lot of people are blocked in the thoracic, so they're blocked in this area and they're lacking rotation. Therefore, the lumbar is having to excessively rotate, and the cervical spine is also having to excessively rotate, or worse of yet, what I see often is spinal flexion followed by rotation. All right, so that's that bending of the back, then rotate to go around the problem. Now, this is a position that the body does not like, and in this position for long periods of time, you are going to have back pain in the spine, the muscles that surround the spine. Therefore, we must increase rotation or regain rotation through the thoracic, specifically the thoracic, yet this exercise will cater for the whole shebang. So there are 2 versions of this exercise. One is on the floor, which is good because the hips are fixed in place, there can be no rotation. The second is on the wall, which is also effective, yet it has its other merits, such as you can do it whilst you're in your work clothing without having to lay on the floor. Let's get through and have a look at the exercise. Both Luke from Vital Movements. Let's go over, open the books, wall, standing version, and get that spine rotating the way it's supposed to. So you're going to find a wall with a bit of open space. Okay, we need a little bit of room. Standing side on. Hands in the crocodile position, thumbs up. You need to imagine somebody's pulling you from the top of the head constantly with a string. Okay, so you're up nice and tall. Scapula of the outside shoulder into your back pocket. Think that your scapula or your shoulder blade is getting tucked into the back pocket of your jeans throughout the movement. What we're going to do is we're going to stand outside foot in front with majority of the weight, 80-90% of the weight on that front leg. Okay. Pocket, string. We're going to open, following the thumb with the eyes and the head. Slight external rotation of the arm until the point where we start to feel a fair amount of resistance and we can go no further. Following back. Remember those cues. Following. Aim just a touch further. Weights in the front leg the entire time. Okay. Excellent. Now, things to avoid. People often want to get to the wall too fast. What I often see, which is incorrect, is extension to help out. Or more commonly, people bring the weight onto the back leg, rotate through the hips, and it's very easy to get to the wall. Yes, we want to get to the wall, but we don't want to get there the wrong way. Okay? Coming through, weights in that front leg. So this is the wall version of Open the Books. If you have trouble, you can move to the floor version. They're both very effective. Luke from Vital Movements. Luke from Vital Movements. All right, next up is Open the Books. So we're going to work on thoracic rotation. All right, so increase that rotation in the spine. So this is a floor exercise. There's 2 versions. Let's go with the floor version. So on the floor, fetal position, arms in the crocodile position. All right, sometimes I like to use a head support. If your head's quite strong or your neck's strong, don't worry, you can do it in the open. I'll do it in the open. Some people may like to put a pillow or some books to support the head. Not me. All right, so you're in that fetal position, 90-90. All right, we're gonna tuck the shoulders down, so always push them into your pockets. We're gonna open, follow your thumb with your hand all the way around as far as you can manage, and back through. around as far as we can go. Good. And again, as far as we can go. Following that thumb every time. Things to watch out for is as we come around, we don't want to move the hips, we don't want the knees to open, all right? So we don't want the arm to come up, and it's very easy to find as well. So shoulders set, knees down. Sometimes you can pop your hand on top of your knees, that will stop that, and we're going to come all the way around. All right, that's thoracic rotation. Open the books. On the floor, against the wall, they both work well. The key is making sure those hips don't move and you rotate through the spine. So this is an exercise that should be done daily. 3 sets of 5 to 6 on each side. If you're doing it less, say 3 times per week, you can maybe work up to 10 repetitions on each side for 3 sets. All right. This is also something that you can do a couple of repetitions between patients on each side, just to help that rotation happen whilst you're working.